What is the AMA's advice for under 60s considering getting the AstraZeneca jab? Would you really prefer to see that under 40 age group remain unvaccinated than be vaccinated with the AstraZeneca?
Look, there's a lot of confusion out there, and unfortunately the Prime Minister's thrown a little bit of a hand grenade into our vaccine program. And I think that today shows why we need to keep the politicians out of health discussions and leave them between patients and their doctors. The AMA is clear that the ATAGI advice needs to be taken into account by everybody. The advice is clear, but it is just advice. And that is that anyone under the age of 60 is preferred to have Pfizer. That hasn't changed. The Prime Minister hasn't said that that's changed, nor has the Health Minister. That is the case. What the government have done is remove the restriction, and remember the restriction was there to prioritise older people, and they've removed the restriction simply because they've got supply now of AZ. And it remains now up to patients and their GPs to have that conversation. There are some young people who want AZ because it's available now. That's understandable. I don't think it's for any of us to say, no, you can't have it. But the advice is clear from the experts because they've modelled the risks and the benefits in the setting of a small outbreak. We don't have COVID everywhere throughout Australia, even though it feels like we do as we're all in lockdown today. But at the end of the day, the risk of contracting COVID this year in Australia is low, and that's why the AZ vaccine just doesn't quite stack up for under 60s. If we had COVID everywhere, AZ would be a great choice because it is still a good vaccine, it's a safe vaccine, and it's licensed for anyone over the age of 18.
Are you suggesting that some of our state premiers might be being a little paternalistic here? I mean, to be clear, ATAGI never said those aged under 60 can't get the AstraZeneca if they are willing to take that risk. This is a personal decision and one that people should be making in consultation with their doctor.
That's right, and people have actually been receiving AZ under the age of 40 right throughout the program where GPs have been willing to do it because the advice never was a ban on those younger people having the vaccine. What the PM's done is removed, as I said, that restriction. Doesn't mean young people are going to get AZ now, but it's available to them if they want to in consultation with their GP. So that's not a big problem. The problem, unfortunately, is just the way that the PM unfortunately put that message out into the community without enough warning to the medical profession, to his own department of health, to GPs or the AMA. And of course, we're seeing this extraordinary reaction as a result of that.
We all want to see our vaccine rollout improve and speed up. One of the ways that we're planning to do this, that the government's planning to do this, is involve pharmacies in administering the vaccine. When I interviewed you a few months ago and we talked about the potential for pharmacies to be involved, you said then that you had significant reservations about involving them in the rollout. Do you still fear that pharmacists are not as equipped as GPs to be giving the jab, or are we at a point now where you are confident that people can have confidence going to their pharmacists to get the COVID vaccine?
The reason for including pharmacists in the vaccine program is to expand the points of presence to some more places to go to. And right now, that's actually not what we need because we don't have enough supply. We just heard Queensland's going to run out. And at the moment, GPs aren't using the Pfizer vaccine because there simply isn't enough of it. There's no need for extra points of presence for AZ either because the program is now shifted. So the few pharmacies that are involved, a couple of hundred, are really focused around areas where there aren't GPs or state vaccination centres doing it, and that makes sense. Pharmacists are professionals who are perfectly capable of administering a vaccine. The concern we have is around those conversations for consent, which are best had with a doctor, and also in the very rare event of an allergy or a severe reaction. Doctors are certainly the only qualified people to really manage those situations, which are not straightforward and can be very scary, even for an experienced doctor. So, we're not totally opposed, but certainly we don't need pharmacists just yet. We need to get our vaccine supplies up. We need to focus on the existing program, which is actually working. And then down the track, if we do need more points, then that's where pharmacy may play a role.
Various state premiers are pushing the federal government to start limiting even further our incoming arrivals from overseas. Would you agree that it is time to start tightening the caps and looking at the sorts of people we're allowing in and out in terms of only allowing in vaccinated people, for example?
It's certainly on the agenda, and as it should be, because of the repeated failures of hotel quarantine. What I'd rather see, though, is our state premiers putting their hand on their heart and saying that their hotel quarantine is as good as it can possibly be, that all the measures that can be taken to improve the safety of hotel quarantine have been taken. And unfortunately, we're seeing again and again that that's not the case right around the country. Australians do have a right to come home, and there are circumstances, quite reasonable circumstances, where people need to leave the country and then come back in again. And if we close those borders, we're going to significantly affect many people's lives. If it's the only way, then so be it. But I'd really like to see that hotel quarantine made as good as possible first.
You mentioned it feels like the entire country is in lockdown. It's about half the country, some 12 million of us under these stay-at-home orders at the moment. We've learnt this morning South Australia seems to have narrowly avoided a lockdown there in that state after it recorded some 5 local cases. Thankfully, in that position, those people weren't out in the community, which is a relief to South Australians, no doubt. Just how significant a turning point could this be, could this week be in our battle against COVID here in Australia?
Well, we certainly haven't seen a situation like this before where there's so much risk going on, or not since, I guess, the very start of the pandemic when we didn't know much about this virus and we were observing the horrors overseas and expecting the same to happen here. So it is a risky time, but I think we are seeing our governments, in particular our state governments, reacting appropriately, sometimes a little slow, but at the end of the day, they're doing what is necessary to limit the viral spread. They will be continuing to learn on the job because the virus has been mutating and changing, and what were reasonable measures taken earlier in the pandemic aren't enough now. And unfortunately, Sydney in particular has learnt that the hard way. I think, though, that we will win this fight, as we have the others in the past, and we'll come back to that longer battle, which is to make sure every Australian who wants one gets their vaccine by the end of the year.